I was talking to my girlfriends about my brain fog and feeling extra annoyed lately because all of us are perimenopausal, so I feel like our emotions are kind of all over the place right now. And she asked some really good questions regarding hormone therapy. So I thought I'd do a really quick hormone therapy 101 session. I'm a board certified family physician. I have a menopause and musculoskeletal practice in the Dallas area. So you've probably heard of HRT or MHT for menopause or midlife care, but what exactly does that mean? So when we start women on hormone therapy during perimenopause or postmenopause, we're really focusing on estrogen because estrogen receptors are literally in our entire body from our head to toe. So when they start becoming volatile and eventually decreased in postmenopause, that is really the culprit for all the annoying symptoms that we go through during this menopause transition. Anywhere from sleep disturbance to the weight gain in the stomach and the hip area, to changes to your hair or skin, you have changes to your digestion and you're constipated, you're having anxiety or heart palpitations, you have vaginal dryness or pain or recurrent UTIs, the muscle aches and the joint pain, you name it. All of that is attributed to hormones. So estrogen is really the superstar when it comes to hormone therapy. And for women who have a uterus, we definitely give progesterone because we want to make sure we protect the endometrium lining of the uterus. Testosterone is also another hormone that we offer for some women. There are different routes, doses, and formulations of hormone therapy, and how often you take the medication really depends on the type of hormone therapy you're on. So we have systemic medications like the pill and transdermal, which can come in like a patch, a gel, a spray, inserts, etc. And you have local vaginal estrogen, which can also come in like a cream or an insert, etc. We do have non-hormone options as well for women who can't or don't want to be on hormone therapy but are still symptomatic. And in terms of how quickly women see an improvement after starting hormone therapy, it really depends on each individual woman and how your body personally absorbs and metabolizes the medication. But I have some women who message me literally the next day after starting hormone therapy, and they are so ecstatic that they feel like themselves again and they feel back in sync with their body and their mind, and also that their husbands and kids are very happy and thankful that they seem a little less cranky. So I've seen women who have immediate results, and then for other women it might take a couple weeks. There's a little bit of a trial and error in the beginning, especially if you're new to hormone therapy, to find the right dose and combination that works for you. And in terms of how long you need to be on hormone therapy, there's no right answer. It's an individual decision that each woman will make for herself. So as long as you're informed, you know the risks and the benefits of hormone therapy. As long as you have a physician that you trust and you work well with, that you continue to monitor the benefits versus the risk of hormone therapy. And again, that would be an individual and personal choice. Lots of options available. There's definitely a science to menopause, but there truly is an art to it as well too. And I think that's the part that personally makes it really fun for me as a physician. So I really do think that there is the right dose, combination, and formulation that works well for you and your lifestyle.